Eliminating bloodstream infections or urinary tract infections are extremely important, not only to the hospitals, but to patients. Patients do not come to hospitals to get sick or sicker. They come to hospitals to get well. Hospitals have a responsibility to the patient to do just that. And everything we can do to eliminate the possibility of a patient getting a nosocomial infection or an infection from the hospital, it's better for them, it's better for us. Ultimately, we don't want to see the patient stay here longer. Financially, it's not good for the hospital. Medically, it's not good for the patient. Collaborative initiatives are important to quality and patient safety by helping hospitals learn to give the right processes for patient safety so that patients do not receive an infection that they don't need or want. They have to have the right resources, the benchmarks, the expertise to do such. And in this collaborative initiative, that's exactly what we get. Memorial Healthcare System chose to be a part of the collaborative initiative because of the expertise that Florida Hospital Association had, because of the leverage that they had to take benchmarks, to take people who were experts in the field and give that information to each of us to improve our processes to help the patient. The interesting part of this collaborative is the outcome. And the outcome has been a substantial reduction, significant reduction in the Class Bs or the central line associated bloodstream infections, as well as the UTIs. It is amazing to see what one can do when one focuses on it and has the right resources to do such. My passion stems from making rounds, seeing patients spend no additional time in the hospital. In other words, being able to leave when they need to and not having to spend additional time in the hospital due to an infection. Passion also comes from me being a past patient in a hospital where I did not want to spend any additional time that I didn't need to in the hospital, and I love hospitals, and I didn't want to spend more time here than needed. And admittedly, our passion comes from wanting to be the best. Memorial Healthcare System, as a recipient of the American Hospital Association McKesson Quest for Quality Prize Award, is a standard. It's the benchmark. It's a bar for others to reach with regard to quality care, the Institute of Medicine initiatives, and safety and quality for patients. Everything that's done in the hospital by every individual, whether it's a volunteer visiting a patient or a physician treating a patient or the nurse being with the patient 24/7, somebody touches that patient and they mean to do well, and sometimes that physical touch may also promote an infection. Everything that's done by everybody in the hospital should be with the patient at their focus, patient safety and their quality. It's extremely important that patients get what they need and not what they don't want. The staff are on the front lines. They know exactly what goes on and how to improve care. Leadership thinks we know what goes on, and we need to listen to those on the front line and then give the right milieu, the direction, and the resources. That's where Florida Hospital Association Collaborative Initiative helps with regard to the Class Bs, the UTIs, and eliminating them. We can get to zero, and that should be our tolerance level, 0 infections. There's importance in ensuring that our staff understands the ripple effects of everything they do or don't do. There are no shortcuts in healthcare. There's a proper way of doing things if you want the right outcome. And if you don't want infections, the collaborative helps you do such. To eliminate hospital-acquired infections means it takes time, and it's done one person at a time. But the commitment of every individual has to be there. It can't be a nodding of the head, yeah, that's really important to do, without a true commitment from the heart and soul to eliminate the infections. to ensure everything that's done for the patient is done appropriately for that patient. It's a journey. It's going to take time. It's worth the journey, especially if I'm the patient.